Are you suffering from pain in your back or neck? Have you been diagnosed to have a spinal problem? Have you been advised surgery for your spine? If you answered yes to any of these questions, then you can come to get yourself treated appropriately by spinal surgeon Dr. Nikhil.
My name is Dr. Nikhil Arbatti. I am a fellowship-trained spine surgeon practicing in Mumbai. My specialization is minimal invasive and endoscopic spine surgeries. Almost all spinal surgeries, including complex instrumentation and discectomies, can be performed by a minimal invasive approach. The advantage of such a surgery over a traditional open surgery is that it involves a smaller incision, less blood loss, thus a shorter hospital stay and faster recovery. Be confident to choose me as your spine surgeon to successfully deal with your spinal problems and surgery. Thank you.
Dr. Nikhil is a minimally invasive spine surgeon. He has completed his graduate and postgraduate training in orthopedic surgery from South Gujarat University, where he secured a gold medal in his MBBS. Dr. Nikhil has done more than 4,000 spine surgeries, out of which more than 1,500 are minimally invasive, or endoscopic spine surgeries. He has undergone extensive training in minimally invasive and endoscopic spine surgeries, from South Korea. He has also been selected for the prestigious IGASS fellowship twice. Now, let's discuss about the spine in detail. Anatomy of the spine. The spine has the spinal cord in the center, which starts below the brain and ends at the tailbone. The spinal cord has got nerves which arise from the spinal cord, both in right and left side, and go to different parts of the body. Apart from the spinal cord, the spine is made up of following structures. The bones called the vertebra, which surrounds the spinal cord. Cushion-like structure, in between every two vertebrae, called the disc. There are also ligaments and muscles which surround the spine. Behind each discs are nerves which are coming out of the spinal cord. How does a spinal problem occur and what exactly happens? There can be sudden pressure on the nerves due to a slipped disc, or chronic pressure due to ligament, or bony overgrowth. This compression of the nerves leads to release of chemicals causing complaints like back or neck pain and arm or leg pain. A slipped disc or bony and ligament overgrowth can occur due to lifestyle problems, hereditary causes, or due to any infection. Also, by birth some people may have structural weakness in the discs. Also, lifestyle and medical factors are big contributors. How to diagnose and treat a spinal problem? A spine surgeon is the person qualified to address a spinal problem. Diagnosis is done by clinical examination, by taking proper history and physical examination. Also, various tests like MRI, CT scan, X-ray and some nerve and blood tests are required to confirm the spinal problem. These tests can be done at any good imaging center. Most of the spine problems can be managed by physiotherapy, rehabilitation, proper ergonomic training with the help of a spine surgeon along with a trained physiotherapist, and sometimes injections for pain management. Who requires a spine surgery? Patients who start developing weakness in their hands or legs due to a spinal problem. Patients who are having severe pain not relieved by painkillers, rest, physiotherapy, even after extended period. Obese patients unable to do any exercise due to obesity and in whom spinal problems are worsening. We have to remember, less than 20% patient with spinal problems require a surgery. How is minimally invasive spine surgery done? Minimally invasive spine surgery is done through small incisions. Muscles are not cut. They are separated by the use of long retractors, which do not damage muscles or cause bleeding. In the surgery, advanced microscopes and other specialized instruments are used, which give a better and magnified view of the area to be operated. Thus we are able to perform delicate surgeries without any major complication. Is minimally invasive spine surgery risky? The surgery is done with the help of various advanced instruments, which help in better visualization and correct placement of instruments and implants. Some of these instruments are microscopes and nerve monitoring equipments, plus intraoperative navigation. All these equipments prevent any major complication. Can a person after a minimally invasive spine surgery lead a normal lifestyle? As the tissue damage is very less, the recovery period is shorter after a minimally invasive spine surgery, also it's less painful. Thus, the patient is able to resume normal activities very soon, and in the long term there is minimal restriction of lifestyle. What are the benefits of minimally invasive spine surgery? A small incision is made instead of the routine big ones. The chances of complication is very less by use of microscopes and other instruments for visualization and monitoring. Blood loss and muscle damage is minimal as normal structures are not disturbed. Post-operatively, the surgical site pain is very less, the patient is mobilized very quickly and recovery is faster and better.
My main problem has been my back pain, and it has been there for many years, and this pain can only be, I've referred it to my orthopedics, and they have been asking me to go for a surgery because there has been a decompression on my nerve on the L4, L5 and the L5S1, which can only be treated if it is done on a surgical method. I've been taking medicines, painkillers, but then it helps for some times, and then over the years it again kind of comes back. That has been my main problem. Well, like I told you, I've been visiting many of the spine surgeons, and when my Air India medical department told me that I should go and visit Dr. Nikhil, so I had no idea what kind of a person he would be, because all the doctors, they look so serious and formidable, because of their position and all. But the moment I saw Dr. Nikhil, and I immediately, I was relaxed, because
he's very friendly.
Yeah, of course he's young, and he kind of
He knows his job.
He made it look very simple, and then I, of course, like, it's my habit to, whenever I visit a doctor, I want to know more about him. So I came home, I studied whatever there is available in the net, and I saw some of his YouTube videos also, and the more I read about him, I became more confident. And my Air India doctor, Dr. Tulbhatkar, also spoke very highly about him. So after Diwali, we decided on a date, and things followed. Yes, I'm doing my exercises, and things are normal.
For more specific advice towards your spine treatment, you can contact Dr. Nikhil. He is a consultant spine surgeon attached to various hospitals in Mumbai. Nanavati Super Speciality Hospital, Bhatia Hospital, Shushrusha Hospital, Sanjeevani Hospital, Health High Tech Hospital, Asian Heart Institute, BKC, Saifi Hospital, For appointments, please call 1401-4156-673. Email your queries to nikhilarbatti@gmail.com or visit www.thespinesurgeon.in.